Senatellis. I'm an implementations and training consultant here at ZMed. And in addition to that, I've also been quite actively involved in bringing in prescribing across to our ZMed community. Joining me today, we've also got Sarah Wiles. Now, Sarah Wiles, for those of you that haven't met Sarah, is the manager of digital health and systems integrations with the country SA Primary Health Network, and she'll also be co-presenting in this session later on to in the session. So we're lucky enough to have Sarah. So if you do have any questions regarding the program and its rollout in South Australia, Sarah will certainly be a great person to help us answer those. Today we're covering a few e-prescribing items, and they are predominantly items that are relevant to the setup of e-prescribing within your ZMed practice. So this session is ideally catering to the practice managers and administrators, people that really want to know how to set it up in the practice. We are also running another session next week that's more targeted to a doctor training and how doctors will actually prescribe, and the different regulations and ways of doing prescriptions in using electronic prescribing. So we're splitting up the session today with an e-prescribing overview to start off with. So we'll give you a bit of an update of where things are at. And then we're going to have a look at ZMed and how you can set that e-prescribing feature up in your practice, followed by a quick demonstration on what an e-script looks like in ZMed. No doubt there'll be some questions along the way, and I think the best way to ask a question is using the chat function which is located right at the bottom of your GoToTraining toolbar. So if you have a question, just simply fire your question away. It doesn't matter when you do it. We'll if it's topical and we can cover it off as we go, we certainly will. If not, we might dedicate some time towards the end of the session where we review all of our questions and provide you with the answers, which I have absolutely no doubt we'll be able to do so. So I thought a really good place to start today might be to kick it off with some an update on I do apologise, with a news story that was available in SA on Channel 9 yesterday, which gives a great overview about electronic prescriptions in South Australia. So just bear with me for a moment while I hit play and just enjoy the short story. Oh, no audio. I've just been advised that we haven't got audio on that video. So what I will do is share that link out with you later, and you can certainly watch that in your own time. But just to keep things moving, I think we might have a look at electronic prescribing and what it actually is. And it essentially, electronic prescriptions are just an alternative to paper prescriptions, which allow our patients and our people the convenience to manage the way they dispense their medicines. It also lessens the risk of infection being spread in general practice waiting rooms and across community pharmacies, particularly in the current environment with COVID. So some changes were made to the Commonwealth legislation to recognise that electronic prescription is a legal form to allow the supply of medicine, and it provides both prescribers and patients with that alternative to paper prescriptions, as I just mentioned. Having said that, though, paper prescriptions will still be available. So there might be a situation that you come across where an electronic prescription is not the best solution for your patient, or they may not just simply want to use the new feature, and you will always be able to, at this stage, still issue paper scripts. Interestingly enough, though, we saw the escalation of electronic prescribing, particularly in Victoria, where I'm based, in response to COVID. So I know that we went through a period where we were getting quite low volumes when it was first launched in a community of interest model, to now the majority of scripts moving over to the electronic prescribing platform, now that we have all parties on board in Victoria. The good news is that we've had that same escalation being recently applied to South Australia as well. So for those of you that did participate in the community of interest model, where you did notice that there were only a handful or a selected pharmacies, that has significantly changed now, where you'll find that the majority of pharmacies in South Australia are now electronic prescribing enabled. Electronic prescribing has been launched with the initial model of the token model, and you can see here on this slide that basically we are sitting right in that middle electronic token model, which is available to patients via an email or an SMS. Later on in the timeline, there will be a second model, and that is the active script list model. And I think we're going to touch on that a little bit later on. But essentially, the two models still provide the same outcome. It's just that we have been told that the electronic token model was easier to implement in a shorter time frame in response to that COVID situation. So as mentioned, the token model is the current solution that we have for delivery for all electronic prescriptions. It was accelerated, kicked off around May, but it's now been accelerated throughout the country. I think with the exception of Western Australia and Tasmania, most states are now at a point where where patients can quite easily dispense using the token model. Another interesting point to bear is that the token itself is not a legal prescription, but it can be used by an authorized pharmacy to unlock that legal prescription, which often we get quite a few questions around who can get this token and where can we send it to. But because it's not a script in itself, it means that we can actually push this token out to other parties beyond the patient. As mentioned, there is another version of electronic prescribing coming out, and look, the ETA on that was later this year. Given that we're in December, it might be the start of next year. But this new model, the active script list, will provide some more functionality in addition to what we're currently using at the moment via the token. Basically, under this model, pharmacists will be able to access all of a patient's electronic prescriptions by retrieving their active script list, and that'll give our patients a lot more control with their scripts. They won't have to rely on a token at an individual medicine level. They'll basically be able to walk into a pharmacy, identify themselves successfully, and that pharmacist will be able to see their entire prescription list and dispense the medicine that's relevant at that time. Naturally, more information will be provided once we ourselves have information supplied to us and together with dates of launch. Lots of benefits that we've seen firsthand with electronic prescriptions. No doubt the biggest benefit is I suppose the contactless nature of the script. It makes phone consultations or telehealth consultations super easy. It also gives a lot of our patients the ability to access medications via the token being sent to carers or family members or helpers. So in the past, obviously, they, you know, a traditional script was a paper-based copy where lots of touch points were required. In this case, we do have the ability to push out a token, and that token can quite easily be shared amongst people that are aiding the patient, i.e. carers, family, friends, etc., etc. It also, and I think another benefit that I quite like is the ability to cancel a script now becomes immediate. So in the past, you know, depending on whether you were using, you know, a prescription exchange provider such as ERX or MediSecure or handwriting scripts, the reality was that once you issued a script, that script was out in circulation. With electronic prescriptions, the minute that you cancel a script or void a script, that effect takes it's effective immediately, and that patient will no longer be able to dispense, as that link to the script is a live link and it's constantly being updated. All right, let's get into some detail here. Let's have a look at how you set up your practice for electronic prescriptions. Now, I think the very first step is to ensure that you have a NAS certificate with Services Australia or Medicare. So a NAS certificate, and I'm sure that most of you will understand what that is, but it essentially gives you the ability to use Medicare online services. And electronic prescribing is certainly one of those services, as are My Health Record, etc., etc. So, step number one is to make contact with Services Australia and ensure that your practice has a NAS certificate. Now, for those of you that don't have a NAS certificate, you'll know, or have a NAS certificate, you'll know that without a NAS certificate, you won't be able to really proceed in ZMed and set up all the additional requirements such as HPIIs and HPIOs, which are healthcare provider identifiers. So I'm going to show you very quickly how that NAS certificate is set up in ZMed, in case you haven't already done that. So once you've received your NAS certificate, and you normally receive that via a disk or from your Proto account, you'll also receive a corresponding PIC, PIC, and that PIC essentially is your password. So basically, the very first thing that we do is we go into our clinical records. And once my clinical system loads, we simply go into our tools, into our global options. And then we have a section here called communications, a tab called communications. And right underneath that, we choose the SMD and My Health Record tab. From there, it's important that we update the My Health Record URI to show this https:// .health.gov.au. And then we choose the load certificate feature, and then locate the certificate that we've typically got on a disk or maybe on our desktop, and that will bring the certificate into ZMed and ask you for your password or your PIC. Once you've completed this step, the rest of the setup is quite straightforward, but you will not be able to progress in any way unless you have actively installed or applied for, received and installed your NAS certificate in ZMed. Once you've done that, the very first place that I recommend starting is by updating your healthcare provider identifier at an organization level. And to do that, we basically go into our practice setup, into our practice, and you can see here that our HPIO setting, and in this case it has already been updated, is searchable by using this search HI service. So this feature will not become available to you until you upload your NAS certificate. So if you find that you've come into ZMed to load your HPIO or HPIO, but it's not searchable or it doesn't work, that is because your NAS certificate has not been uploaded successfully. So having said that, you can search for the HPIO at organization level two ways. You can search it by entering the HPIO number in yourself, or alternatively, if you choose on other details, it will and obviously enter your organization's name here. It will use that information to make a search. My recommendation is that you basically, if you know your HPIO number, simply click on the HPIO number search field, enter the number into the HPIO number field, and then use the search button. You'll see there that automatically the system will go across to Medicare and do its search. And when successful, you'll have a HPIO number shown here. And then we basically just click on our save selected HPIO, and that system is now updated with your HPIO number. The second component in relation to HPI is to get the individual doctor's health provider identifier. To do that, we almost do it in a similar way. However, in practice setup, we go down to our doctor's individual profiles. So if you're looking for a doctor, you could basically bring your doctor's profile up. And here you'll see the search HI service. Very similar screen to the HPIO. If you know the individual doctor's HPI number, type it in. If not, you can use other details, and we'll be able to search based on the doctor's family name, given name, etc., etc. Okay, so again, once that search is complete, you'll see it listed here, and then we basically select it to ensure that it's saved against the doctor's profile. Whilst we're in the doctor's profile, there are a few new things that we also need to action. And the first one is that with electronic prescribing, it's important that we have the doctor's qualifications updated in ZMed. So, so that's done in these clinical settings qualifications section here, in addition to the basics such as prescriber number and a provider number, etc. Now, it is important that your your prescription exchange provider reference, if it's ERX, is also listed in here for the individual doctor as well. Now, with ERX or MediSecure, ultimately they do provide the same outcome. So it is a preference on what your on who your practice uses. So, in addition to qualification, there is an extra section here that's quite new and it's been built specifically for electronic prescribing, and that is the text for specialty treatment. If you drop that field down, you'll see that if you are a prescriber that has a specialty, and in particular one of those 6 here, that you should also select that. So if you're a dentist and you're prescribing, antibiotics, for example, you will select for dental treatment only. If you're for general practitioners, you would leave this blank. All right, so HPII in the doctor's section, qualifications in the doctor's section, ERX entity ID in the doctor's section, together with any specialty treatment if applicable. All righty. We have seen with the HPII, and we'll probably cover this off in the FAQs as well. If you've followed these steps and you're getting an error, we have in the earlier days of electronic prescribing, we were getting an error saying that it was error WSE001, etc. There have been some cases where the HPII, although provided to the doctor, wasn't successfully allowing them to prescribe electronically. What we found is that when you see an error message and you followed all the right steps, there is one extra step, and that is to make the HPII searchable, and that basically allows your HPII to be accessed by other providers, including ZMed and pharmacists, etc. So we'll talk about FAQs a little bit later and some troubleshooting, but that was one thing that we've noticed earlier on in the rollout of electronic prescribing. The third component is your individual patient's individual health identifier, IHI number. Now, I'll open up a test patient here. how about Miranda Kerr? And you'll see that in our patient file, you'll see this eHealth section here. Basically, every patient that is linked to the Medicare system will have an IHI number. So it is a prerequisite for prescribing electronically. So this is how you will identify whether you can or cannot prescribe to a particular patient. If they have an IHI number, you can. If they don't, and that namely will be people overseas, for example, that aren't part of our Medicare system, you will need to rely on a traditional paper-based script. For individual patients, we can set up, and we should set up ZMed to automatically update each patient with their IHI number. So there is a setting in ZMed which I will show you that will basically go into each patient's file daily and ensure that their IHI number is up to date. If, however, you are creating a new patient and that search hasn't automatically happened because it only happens, say, overnight, you would click on the eHealth section and then use the search HI service function and look up the individual IHI number for the patient. Now that will basically, that IHI number will be located using patient demographics such as name, date of birth, in addition to their Medicare number as well. Okay, so whenever we're in a patient file, glancing over the patient demographics to ensure that their IHI number is visible and listed and updated will indicate whether you can or cannot prescribe electronically. Now, once we've I'll just get out of this. Once we've made all of those changes to our system, we're able to prescribe electronically. And I might just run through a quick prescription just to show you how easy it is and what it might look like for a patient and for your doctors as well. So back into clinical, this time I'll open up a test patient. Maybe not Miranda Kerr, maybe we'll use someone that has some more data. How about Mr. Nut Holloway? So you can see here in this patient profile in clinical, once I acknowledge all the warnings and alerts, you can see in our patient demographic section, their patient's IHI number is listed, they're active, and it's been verified, okay? That automatically tells me I can prescribe. From there, I can go into my drugs module, acknowledge any alerts, and search for a new drug. And this time I'll just do a quick Panadol. Maybe Panadol tablets. I choose the prescribe function. I use the dosage calculator. And then you'll see the inclusion of this new button here that's called prescribe electronically. I do still have the option of prescribing traditionally, and that's just in this section here by using prescribe. But in this case, if I use prescribe electronically, I'll get this new screen appear, and this new screen will have your doctor's details listed up the top, followed by the patient's details, followed by the medicine, including dosage and any repeats. There is a route of administration as well. So if there was more than one way of taking this medicine, it would be available to be chosen there. So if there was, say, oral or intravenous, you'd be able to drop that box down and pick the right one. We have a section here for specific notes to the pharmacist. So if the doctor was prescribing something that had that was out of the norm or that was going to be used for a different type of clinical indication, they are able to free text information to the pharmacist to avoid any confusion or any phone calls to the unnecessary phone calls to the doctor. In addition to that, the doctor also has the ability to specify the clinical indications. So throughout the consultation, if they're using ZMed and they've actively identified a problem, that problem will be there for them to choose. Alternatively, they can always free text a clinical indication as well, and that'll help that pharmacist really talk to the patient about the type of medicine they're taking and for the reason they're taking it for. We have a minimum repeat interval in days. Now, I really like this feature because it gives you the confidence to prescribe certain drugs that typically you may not include a repeat on, because now you can put a day period in there to stop the patient from filling any repeats until that period has elapsed. So I know in certain states, and I don't think South Australia is one of them, perhaps Sarah can advise otherwise, but I know in New South Wales, for example, there are certain S4 or S8 medicines that where we must specify a repeat interval. Although it may not be mandatory in South Australia, it's certainly something that the doctors can utilise to ensure that scripts aren't filled concurrently, and obviously we have the ability for patients to take more than they should be. Warrant number in South Australia, when you log into your ZMed, you won't actually see the word warrant listed there. I believe in South Australia it is an authority. So if you are a prescriber that has an authority to dispense a particular drug dependent on your specialty, i.e. you don't have to call up and get an authority each time you prescribe, you are able to type in your authority number in this section here, and that pharmacist will be able to cross-reference and do their bit before they fill that script. If there's something unusual about the dose, we basically can click this little unusual dose button here just to make sure that the pharmacist knows it's not an error. This script is for urgent supply, is an emergency script. So if you do have a patient who has run out of medication and that pharmacist has provided some out of hours medicine or a couple of additional pills for just to tie them over until they get a script, this feature is also going to allow you just to email that script over when you're backfilling. So to do that, you basically click on this script is for urgent supply, and in the email section, you would enter in the pharmacy email address. And that pharmacy will automatically receive that script, and there's no more scanning or posting. There is initially when we rolled out, people were asking if they could just email scripts over to the pharmacy, and the answer is that that's not that. Although the functionality is there and that's what that button does, I don't think it's something that the Australian Digital Health Agency encourage you to do, because ultimately it is the patient's decision on where they will fill their script, not the doctor's, and that might be seen as yeah. Sorry, is that you, Sarah?
I was just going to say, with regards to our aged care providers, those people who frequently work and respond to services required in aged care, you can immediately see the benefit in this, in that it is a straight supply to the pharmacy. And so for those providers who have a relationship with the dispensing pharmacy for the residential aged care facility, it would be really advisable to have their email details on hand, and that would ensure that any of the phone call interventions and consults that your GPs provide on a regular basis can have this supplementary support to you. It will greatly enhance your paperwork management, I think.
Cool, excellent. And in addition to that, we're just about to dive in. It's a good segue because we're about to dive in to the SMSing and emailing and who can physically receive these QR codes. So at the moment, there are two options of distributing an electronic script to a patient. The first one is via SMS, and if ZMed has been updated with the patient's SMS number, it will automatically default in this section. You do have because electronic QR codes are able to be sent to anybody at the patient's request, you do have the ability of updating this field whilst you're actioning it. So you don't necessarily need to go into a patient demographics to update the mobile number. I can simply update it directly as I'm issuing the script, knowing that it will only be applicable for this script and it will not change any patient demographics. So if I was to go in and prescribe something, then tomorrow, it will default again to that patient's mobile number. So just on, and the reason I said it was a good segue is because depending on how your patient is managed, this might be a carer, this might be someone in that aged care facility, it might be a neighbor, it might be a sibling, brother, etc., etc., etc. Okay. The same goes with email as well. Ultimately, if there was an email address linked to this patient, it would default here. Alternatively, you would free text an email in this space. And again, it can be any email as long as that patient has instructed you to email it to that person. Now,
I'd just like to raise here, sorry, Danny Byrne brought up a very good point earlier in the week. Our children or teenagers will have, for instance, their parents' mobile numbers automatically populated to this setting. So
yes.
It's strongly advisable that if it is a young person and it is a prescription which their parents, which they don't wish their parents to know about, that you check and ensure that the teenager's mobile number is included in here.
Yes, absolutely. Great point. So just in relation to the delivery of the QR code, it is either SMS or email, but not both. So when you're consulting and you ask the question, they can only at this stage only have one or the other. Although the two are quite transferable. So for example, and what I mean by that is, I know that when I've tested the system out and when you receive the SMS itself gives you an opportunity to copy the token and email it across to somebody else, or just text it to somebody else as well. So even though you're prescribing and issuing the SMS to a patient, that patient has full control over who gets that QR code. They're able to send it to anyone they want, essentially. So in this case, I might try the good old SMS. The third button down here is no electronic token, and essentially that electronic scripts are still suitable for people that don't have an SMS or email, in the sense that it's still you are still able to print out a QR code. So if you do have a patient that where you don't want to issue a traditional script and they don't have access to a mobile phone or an email, you can select no electronic token and simply just print out that QR barcode and hand it over to the patient. Okay, so that's what that's there for. Having said that, when you've updated those details and selected the method of delivery, all we do is choose prescribe electronically, and it's a lot quicker than this. It happens almost instantaneously. You'll see that I've prescribed the medication. What you can't see, unfortunately, is my mobile phone, which has an alert on it and a QR code. But over here under today's drug descriptions, you can see the inclusion of a new icon, and that icon here is our electronic, indicates that it's been prescribed electronically. So when you are looking at existing medication, and if we have a look at the first diazepam, for example, you'll see the first script was a traditional script, followed by the second script, which was issued electronically. Okay. Now, I mentioned about the link being a live link, and this is the feature that I think is really great, in the sense that at the moment, when I click on my SMS on my phone, it takes me right through to a QR code, and it tells me the name of the medicine that I have access to prescribe. If for whatever reason there was an error, or the doctor or the prescriber decides to cancel that, they would simply right-click, cancel the script, cancel the prescription, And now you'll see that I've got this little red X in that icon, which indicates it's been cancelled. But what happens immediately is that my SMS with the link to the script has now updated immediately with a message, this script has been cancelled. So even if you make a mistake or if you change the medication, you have full control over what patients can dispense. Naturally, if I've made a mistake, for example, and I wanted to reissue that medicine with a different strength, for example, I could do it without needing the presence of the patient, and it would be pushed out immediately as well. So, so it's quite easy to use. In addition to that, for existing medication, and you can see these test patients had a bit of everything over their course, you can simply right-click to re-prescribe, but this time you can update the system to prescribe electronically. So even though you're looking at a previous script that was issued traditionally, you can just re-prescribe, but this time do it electronically. So there is some good functionality there. So that's pretty much how a doctor would prescribe electronically. A few of the problems that we've had initially anyway were with people accidentally deleting the email or accidentally deleting the script. If you do come across that situation, you do have the option of reprinting the script. Oh, this one's been cancelled, but you do have the option of reprinting the script via a paper QR code and handing it to the patient. Alternatively, you would simply cancel the script, which cancels it immediately, and then re-prescribe and push it out again via SMS or email and just give them a new QR code. So the workaround is quite easy to use. Just another thing I wanted to make mention, there is the ability to turn e-prescribing on and off at a practice level. And at the moment, because we've been using e-prescribing at ZMed since May, however, South Australia wasn't quite ready yet, you'll probably find that when you go into tools and global options, you'll see in the drugs tab, you'll see that this electronic prescribing checkbox needs to be ticked. Now, if you do find that you don't have the ability to enable electronic prescribing, you might be grayed out, you'll need to contact our support team on 1300 933 000 and just let them know that you're in SA and that you'd like it to be activated. We purposefully disabled that feature because South Australia just wasn't ready at the time when our software was. So if you do see that and you're unable to select electronic prescribing or to enable electronic prescribing, just give our support team a call and we'll be able to fix it up on our back end. There are some doctors that just don't, for whatever reason, may not be interested in using electronic prescribing. It may not suit their needs. Each doctor has full control on whether they have that option or not under tools and my options. And again, in the drug options tab, you'll see that each doctor can simply tick or untick this checkbox here, and that'll just remove the button from their prescribing screen if they don't want to use it, so they don't have to see it or get confused by it. So in summary, electronic prescribing is quite simple to set up at a practice level. Step one is to make sure that you've got the NAS and the password or the PIC that comes with it. Step two is that you've updated your HPIO and individual HPIIs. And then step three is to make sure that your patients have an active IHI number to be able to use the feature. We will send out, as mentioned, next week we'll be doing some dedicated doctor training as well. But at the end of this session, I'll also send out some links to our website where we've uploaded some how-to guides both from a practice manager's perspective and also a prescriber's perspective. So if you do forget on the steps required to enable it in your practice, we'll have those listed there step by step, so that you can just follow the instructions and get it up and running in your practice. I might move over to you, Sarah, if that's okay, just to continue with. And I'll just
sure, thank you. If you just want to jump through. So good afternoon, everyone. My name's Sarah Wiles. Been working with Country SA PHN now since 2008, from whatever all the way through. Just want to also heads up that David Earl is also online, and David's from the Adelaide PHN. So what I'm discussing this afternoon is actually information and support that's available from both Country and Adelaide PHN to all of our prescribers. So I'll just quickly jump through the first slide to the next one. So we want you to get a sense of the cumulative benefit. That is the work you do now to initiate and start electronic prescribing will process into the use of the active script list. The active script list will be a significant benefit for those providers who work with residential aged care facilities, as it will be that functionality that enables your prescribing to go directly into the online medication charts. And so this is where you or the pharmacy will be registering a patient in order to have that capacity available. Early next year in South Australia, we will see the introduction of real-time prescription monitoring. And this will be calculated and work in with the electronic prescription function. So the authority that you request will be electronic, and it will automatically be input into your electronic prescription. The workflow has already been established in Victoria, where electronic prescription is in, where that real-time prescription monitoring is in place. And the only thing you have to do at that point is then actually register with Script Checked for South Australia. So please be aware that what work we do now for electronic prescribing has a cumulative benefit, and that when we come to real-time prescription monitoring, the conformancy that you do for this is going to be a mandatory component from early 2022. So on to the next slide. Thanks, Milton. Now, a lot is happening in general practice and specialists at this point, and we're very conscious of the pressure that is being applied to healthcare provider organisations to reinvent, to adapt and to change. And we know that other pressures that are really pushing adoption of the use of digital health platforms, COVID, so the initiation and the start of telehealth, and we know that future telehealth is entirely dependent upon our ability to have electronic prescriptions to support it. We know that practices and everyone are going to be hit with how we manage immunisations in the future. And so our registration for the Healthcare Identifier Service, the updates for our provider identifiers, will actually lead to that capacity to also report and have our activity correctly recorded with the Australian Immunisation Register. We are going to be experiencing system changes from the Department of Human Services. So you would have received emails at some point about web services transitions. There's going to be certificate functions that change from being Medicare certificates to being online functional certificates. But please note, there is always going to be something called a NASH. And NASH stands for the National Authentication for Services for Health. And it's a function that acts as the encryptor. This is the security mechanism that is applied to the communication for the prescriptions that are delivered, and also for how you send and transfer clinical information through secure messaging and update information to the My Health record. In South Australia, we have a massive reform. It's fantastic. We're going to see secure messaging implemented early next year. That will see discharge summaries and documents sent to you, and you will be identified and documents will come to you using that NASH certificate and based upon your registration in the Healthcare Identifier Service. Next stage of that will be the use of electronic referrals. We'll also see the implementation of e-requests for pathology and imaging. So really important functions that are going to be happening with the SA Health reform process, obviously including real-time prescription monitoring as well. And finally, whilst we've been all worrying about COVID, The Royal Commission into Aged Care has been continuing, and there have been some significant recommendations which will impact general practice. General practice and pharmacies are the two partners most significant to the outcomes that are expected to improve care in aged care. That is how you communicate with them and how you manage medication with those facilities is going to be changed, and it's going to be improved to improve those health outcomes. And so the work we do now will enable that facility, and we'll see you being able to support and implement the online medication charting platforms. So how are we as PHNs to support you through all of this pressure and the changes that are going to come? And so this is a really rough timeline, and it really gives you an idea of the pressure that we're under. So right now, we know that we need to get electronic tokens happening, and we want to have this happening so that when we come to March onwards, you have a timely capacity to respond. It gives you at least 3 months to feel comfortable with how you're managing electronic prescribing before you have to register for real-time prescription monitoring. So yes, I know it's over Christmas, it's problematic, but we will be there to support you and keep you updated the changes as they occur. And then underneath the support we will be doing for medication management, we know that many providers will be touching base with us on how they manage their Australian Immunisation Register access. Are you connected? Have you linked all of your providers? Is the process working on your Proto accounts? We do know that our residential aged care facilities are under considerable pressure to implement medication charting, and many of you would have received invitations to also participate in these online charts. And your hesitation at this stage is, if I do this, I'm doing double entry. So as we see the tokens and the active script lists implemented, we do know that your capacity to respond and take up these requests from your aged care facilities will be greatly enhanced. And finally, we know that secure messaging is coming, and we'll be super excited. So our support, what will it include? We're super nice. We love Proto and are very happy to assist you in registering for it, navigating it, understanding it, implementing it, and also strongly recommend that all of your GPs get their own Proto account. The power they will have will be extraordinary, including application for PBS approvals online for those special payments, managing their own provider details, and access to the Australian Immunisation Register, just to name a few of the benefits that they can receive. But really important, and any support you need to do this, both PHNs are able to provide. Obviously, we're embedded and addicted to the use of the Healthcare Identifier Service, how to acquire and install your NAS certificates. And although it may not seem important at this point, policies. That is, do you understand the management of secondary use of data? Do you understand what's going to happen and what you're going to implement and how you manage details for your consumers? An example being the teenager with a mobile phone. Are you going to make it a practice policy that as you implement electronic prescribing, your reception people will confirm with that young person, do they have their own mobile phone number? Are they of an age where they would expect to receive prescriptions and manage them themselves? Now that might be the clinical question, but the other question is, are you going to implement those numbers? So that's going to be some discussions where you have about workflow, who's responsible for capturing these patient details, and what, particularly in pharmacy, we've had to have some discussions around policies for this. There are some policies to support electronic prescribing that have been written by the Department of Health. They are in extremely good plain English, some of the best we've ever seen, and 2 of them are specifically directed towards information you can give to your patients. So we really recommend you read them and you make use of the very good language that is in them, but please note they cannot be adapted, changed, or merged into a policy bearing your logo or your sentiments. They are as they are from the Department of Health. We've got access to lots of training and resource links, both from the advocacy groups, RSEGP, ACRM, and also from the Australian Digital Health Agency. Obviously, we work to keep you supported, and there's some excellent knowledge between our practice support teams of how to manage different vendor products. And if you have any queries or concerns and want to double check anything about accessing or using anything in ZMed, please let us know. We're very happy to support you. So Adelaide PHN, David, did you have anything you'd like to say? I'll put you on the hook there, David. Oh, he's dropped off. Sorry, I think he's left. Sorry about that. No, but so Adelaide PHN can be contacted at practice support at adelaidepHN.com.au, and our practice support team at Country SA PHN can be contacted at support@countrysapphn.com.au. And I do believe that Julie Dorito is also online. So hi to Julie, and thank you for being online. I will now hand back to Milton.
Thank you,
happy
Sarah.
to take any questions afterwards.
Thank you so much. So I might just at this point just go through a couple of the questions that have been that have come up as we've been going through the presentation. First one that I'll address is multiple prescriptions. Each medicine will have a separate QR code, and I think James addressed that on the chat. But if you're seeing a patient and there's more than one thing to prescribe, it means that they will get 1, 2, 3, or 4 QR codes. In addition to that, if there is a repeat, we spoke about repeats briefly, but what I didn't mention is for a medicine that's been prescribed with a repeat, it is only 1 QR code. When that patient goes to the pharmacy and fills that first script, the pharmacist then pushes out that subsequent QR code for the second repeat, and so forth and so forth and so forth. So that's the way, and at any given point in time, the patient has full control over where they dispense that medication as well. So they might start off at one pharmacy, fill the script, the pharmacist pushes out the subsequent QR code for the next repeat, and then that patient might decide to go to a completely different pharmacy, and the system will work the same way. I'm just filtering through if there are any other questions. Could you please tell us how to set the IHO numbers automatically in ZMed? I sure can. Just give me a second. So Susan, you asked me how to set up the IHI numbers, and we'll do that right now. So if we go, just give me a moment, and so if you go into your practice setup, into your practice details, down the bottom here, you'll see a HI service settings, and you can set it to do a batch search for IHI numbers. So frequency might be daily, starting at whatever time you want it to run. Increase the number of records to be roughly the size of your database or patient base, I should say. And then if you just close this, the system will automatically do that search daily. The only ones, as mentioned before, that you're going to have to do manually are new patients that join you. Obviously, they'll be picked up the next day, but if you should do that manual IHI link so that the doctor can prescribe electronically immediately.
Also, please note that for an IHI search to exist, you must have entered the patient's name as it is written on the Medicare card, including the Medicare card name, number and expiry date. So without that information being in place and matching the Medicare record, the IHI search will not proceed.
And Sarah, the good news is that with ZMed, whenever we enter a patient name and Medicare number, we perform a Medicare online validation. Yeah, so we'll always have that information correct. Look, I have collected an array of FAQs over the time. I will certainly distribute these with you. Some may be relevant to you, some may not be. We often get asked who pays for the SMS, for example. That's always a top 10 question. At the moment, the Australian government is paying for the SMS, and I believe that it was until the end of September. They have recently extended that until I think it's
the end of
31st of
March.
March next year. Yeah, so it isn't going to cost you anything at this stage. I know that with ZMed in particular, we'll see if we can negotiate some better rates with some of the suppliers that we're working with. But in the interim, you don't even have to worry about it. So that's a good outcome. Are there any other questions? I don't think there are. All right, next steps. I will email all of you today with links to the how-tos, how to do a NAS, how to do a IHI, HPIO, HPII, etc. So if you do get stuck, click on the link, follow the instruction. It'll be fine. It'll be nice and easy. Our support team is on hand if you get stuck. If you get stuck in any way whatsoever, something's not right, doesn't look right, give us a call on 1300 933 000. We'll be able to assist you immediately. In addition to that, next week, as I mentioned, we're running a doctor's session. So if I could ask for your help and try and get as many of your doctors onto the next week's webinar. It won't be as lengthy as this one. We're not going to go through, the how to set it up in ZMed, etc. We'll dive straight into the how to prescribe. I've noticed that a lot of doctors are sort of reluctant to use it, but as soon as they start, they just love it.
Yeah,
Absolutely,
and they're also
love it.
they are concerned about S4s, S8s, intervals of repeats, and how the authorities are going to be integrated into their prescribing.
Yes.
And it's really good because for South Australia, it's really important we get this running now so it runs well. So when it has to integrate with RTPM, it will be automatically functional for them. So it's super exciting and super wonderful that it's happening, and happening in such a timely fashion for our healthcare providers that they won't have to try and remember too much or do two different systems at once. It's really important.
That's right. And certainly next week when we have the doctors attend, we'll be prescribing those S8s and S4s and authority drugs, etc., just to show them how easy it is, but also to give them that intelligence, that intel in the background, to give them the assurity that it's safe as well. I think there's been some reluctance there as well. Now, if you're not on version, the other prerequisite, and it's probably the biggest prerequisite, and I don't know if I mentioned it, but if you're not on a version 33 of ZMed or above, you will not have access to e-prescribing. So can you please and give us a call if you need to upgrade, and we'll certainly help you through that, but it will only be a feature that is available in version 33 and above. Alrighty. Well, thank you very, very much for attending, everybody. Thank you very much, Sarah, for your help today. It's been great having you. And we're here to help in any way, possibly if we can. But otherwise, happy e-prescribing, everybody. Thank you very much.
Yeah. No, thank you all for being online, and look forward to seeing you all soon. Bye.